1. Can I stop my overbite from getting worse? Yes, you can. You can stop your overbite from getting worse by not sucking your thumb, chewing your nails, or biting down too hard on utensils. 2. How do you know if you have an overbite? Check your teeth alignment by biting down and smiling. Close your mouth normally with your teeth resting in their natural position. With your teeth clenched shut, smile into a mirror and see how much your top teeth extend over your bottom ones. A slight overlap is normal, but if your top teeth stick out a lot more than your bottom teeth, you probably have an overbite. Get a checkup from your dentist. They can give you a physical exam and x-rays to determine whether or not you have an overbite. They can also help recommend treatment and tell you how severe your overbite is. An overbite is considered severe when the teeth overlap by 3.5 millimeters, 0.14 in, or more. If your dentist notices that you have an overbite, they can refer you to an orthodontist. 3. Is it worth it to fix an overbite? Yes, since an overbite can cause complications in the future. Depending on how severe your overbite is, you might experience tooth decay, discomfort when biting or chewing, or even speech difficulties. It's up to you whether or not you treat your overbite, so if you're concerned, talk to a dentist or orthodontist. 4. How does an orthodontist correct an overbite? Braces are the easiest and most common way to correct an overbite. No matter how old you are, braces can help realign your teeth and fix your jaw position. If you don't like the look of traditional braces, ask your orthodontist about clear plastic aligners like Invisalign. If you do get braces, you'll have to wear a retainer for the rest of your life to make sure your teeth stay in place. Plastic aligners are a great option for minor overbites since they're usually cheaper than braces. However, if your overbite is severe, they might not be an option for you. 5. How long does it take to correct an overbite? You'll need to wear braces for about 2 years. Although every overbite is different, you should expect to wear braces for a couple of years at least. If your overbite is severe, you may have to keep them on for longer. After that, you'll wear a retainer to keep your teeth in place so your underbite doesn't return. 6. Can you correct an overbite without braces? Yes, you can get teeth pulled if your overbite is caused by overcrowding. If you're young, this might be an option for you. An orthodontist might recommend that you get a few baby teeth pulled to make more room in your mouth and correct your overbite. However, this might not fix the problem all the way, and you could still end up needing braces. 7. Is there a surgery to correct overbites? Yes, but it's usually only done in extreme cases. If your teeth overlap by 3.5 millimeters, 0.14 in, or more, your dentist might recommend corrective surgery. During this process, a surgeon pulls back your cheeks and makes incisions inside the jaw. Then, they'll physically move your jaw, which changes your chin shape and aligns your teeth. You'll be in the hospital for about 2 days. Surgery is usually performed if less invasive methods, like braces, fail to fix the overbite. The surgery usually costs between $20,000 and $40,000.